What is scar tissue and how can you improve it? I'm Doc John from Mobility Doc. Welcome to our channel. We're going to go over what is scar tissue, the different types of scar tissue, and how you can change it back so that way you can move fully. First, let's start with what scar tissue actually is. There are two forms of scar tissue that we're going to deal with today. One being more of external scar tissue, one is internal scar tissue. And then within internal scar tissue, I'm going to speak to two different types in particular. So the most common form of scar tissue that we are all aware of is external scar tissue. External, or on the surface of, say, the skin, comes from being cut open, whether it's surgically or there's some sort of trauma. And what the body does is it lays down thicker fibrous tissue that is trying to seal up that tear and to heal us, right? When that scar tissue forms, we should care about that we eventually not only don't have the physical appearance of the scar, but we should also want to have the full mobility back in our skin. That tissue should be able to move around freely. Otherwise, you'll feel pulling and pain, because when scar tissue forms on our skin, we form in that area a lot of extra nociceptors or pain receptors that are very sensitive to any kind of noxious or painful stimulation. So when we break up that external scar tissue on the surface of the skin, what we are doing is we're not only trying to make it look good again, we are trying to restore its mobility. We are trying to make it so that way it's not so sensitive to touch or the heat or cold. That is external scar tissue. That's what a lot of us think of when we're talking about it. But there is another kind, internal scar tissue. Now, there are different reasons why that might form. It can be from some sort of visceral or organ mobilization in a surgical sense. It can also be from a surgery going in and having to cut through the different compartments and layers of the connective tissue and fascia, and sometimes reconnecting the muscle itself. But there is also internal scar tissue that forms simply just from straining the muscle, having some sort of inflammatory condition that creates, like I said, a ton of inflammation. And when that inflammation cools down, there can be adhesions that are formed. And that is something that I feel like isn't often related to each other, is adhesions are a form of scar tissue. Now, we want to deal with how you can improve that scar tissue, whether it's external or internal. I want to really get through to you why it matters that you do so. And again, whether it's external scar tissue or internal, it's not just meant to be cosmetic. In the world that we live in, we are dealing with people who are trying to be active, whether you are a grandparent or an elite athlete trying to make the Olympics or make a professional team. Scar tissue, it influences your ability to perform because it restricts your range of motion. It creates pain, which inherently is going to be weakness. So there's no way with scar tissue you can perform at your fullest. It's important that you deal with it for that very reason. Now, there are agreed upon ways of handling scar tissue, and I want to get into that because there is more than one way to do this, and there are different techniques with different philosophies and theories around this. Now, what's most important is that you get a result. I don't really care if you do one of the ways I'm about to tell you or you're doing another method, but what's important is that you are changing what you are seeing. So remember, the goal is not just to make the scar tissue look better, but it's to improve the mobility of the tissue itself, the pain of the area itself, and it is to improve your ability to perform and function with strength and stability. So the first one I want to get into is scar tissue massage. Scar massage is a method for external scar tissue. You can apply your fingertips to the scar itself and the tissue around it. You can move in a circular motion and back and forth. The idea is you want to have light pressure and you want to find where it looks like the skin is snagged, and where that snag is the direction that you want to continue to work the scar tissue. You want to make it so that way eventually that scar tissue looks like it is moving like the rest of your skin. Now, another method that is also great for external scar tissue would be cross-friction massage. And now that is going to be typically done a little bit more aggressively, a little bit more quickly. You are trying to physically move, usually with your hand still in this case, but sometimes with an object. You're going to move back and forth and all around that scar tissue, again in an effort to change that fibrous tissue. You want to break up the fibrous tissue so that way the skin can heal in a more normal orientation once again. Now again, that is cross-friction massage. Now when we want to get to adhesions, and we want to influence the adhesions that have built up in the connective tissue, in the fascia, between the layers of the skin and the muscle themselves, what we can do is active release technique. Active release technique is a trademarked technique. There are ways that have existed for forever that are essentially the same thing. Don't attack me if you are ART certified. I'm not saying they're exactly the same, but there are techniques such as pin and stretch, which the idea is similar in that you are going to pin down and tack down that area where you're noticing the lack of mobility in the muscle or in the skin, and then you take that muscle or that limb and you move it through a range of motion. Now you're going to shorten the muscle and lengthen the muscle. You're going to bring it in a closed position and into an open position. And while you are doing this pin and stretch or sort of active release technique, what you are doing is you are manually breaking up those adhesions in this case. Now remember, those adhesions are in the connective tissue. Those adhesions are a form of scar tissue and they are internal. You're going to apply a lot more pressure, a lot more force to the tolerance of yourself or the person that you're trying to help. But still, it's going to be a lot more force than that surface scar tissue treatment that you are doing. Now, if we're still talking about fascial adhesions, another technique that works extremely well is myofascial release. There is a lot of opinion and confusion around myofascial release. What it actually is what it sounds like. You are trying to release the muscle from the fascia. You are trying to make sure that the muscle itself is not caught up in the layers of the connective tissue around it, from some sort of trauma, from some sort of surgery, from like trauma, which could be just getting after a really hard exercise and straining a little too significantly and not healing properly. So myofascial release is done in a way where you are doing long, gentle, sustained holds where you are literally trying to find in the connective tissue where the skin, in this case, where the layers feel like they are snagged, like they're not moving. You're using your hands and you are gently pulling the skin in different directions. And when you find an area where it just doesn't move like the rest of what's around it or the other side of the body, you are just gently holding for a long period of time until that fascia has the chance to break up. Myofascial release is not meant to be a really quick surface level only kind of movement. There needs to be some sort of depth to your touch or to your pressure, but it also, most importantly, possibly needs to be long, sustained holds. That brings me to what's next, which can apparently be controversial, but instrument-assisted soft tissue mobilization. When I was in school, what we called it was Graston Technique because it owned the patent. There was really nothing else other than super ancient, millennia-old forms of the same idea, gua sha, which existed well before Graston. The story I was told, I think this is fun, you can always fast forward through this, but Graston was developed by a welder who was a surfer who had an injury and noticed that when he rubbed the area it felt better, so he went and fashioned himself some tools, and those tools he treated himself with ultimately became what is today known as Graston tools. They're really great when dealing with breaking up fibrotic tissue. It can be surface layer, it potentially can be deeper than surface layer. The great thing about using an instrument is that you can save your hands a little bit, but you can also have that person moving in different directions to actively challenge the tight tissue, the tight muscle, and when you are scraping back and forth with the tool, you have the ability to influence that tension and break up those adhesions, break up that scar tissue. Insert the word that you feel most comfortable with. Now, we personally like to use the Sidekick tools these days because that patent is no longer owned by Graston, and I feel like Sidekick has done a tremendous job. We are in partnership with Sidekick, full disclosure, so if you want to buy those tools and you click on the link that we're providing in our description below, that not only helps us, it also will help you because it's a great tool. However, there are other instruments, but I highly, highly recommend that you buy a tool that uses steel because you will feel the actual adhesions. It'll be so much more obvious when you found the targeted area. Now, a method or technique that I didn't see a lot of people talking about, or essentially anyone, is tack and floss or muscle flossing. That is a really great way to improve range of motion. You very much are breaking up adhesions. You can influence scar tissue, whether that be external or internal. Now, we use rock floss from Rock Tape, but any other brand will do. We've created a video on this that I encourage you to take a look at because it is a great way of tacking down an area and moving through the range of motion that you want to improve. And it's something that you very much can just do on your own, and you will get significant improvement very quickly. So again, muscle flossing, take a look at that. I'm not seeing that anywhere, and that is a gem of a way to influence scar tissue and adhesions. A key point to remember with any of these scar tissue or adhesive techniques is that they should be paired in combination with other things, with other interventions or techniques. It is not enough in and of itself to just simply break up the scar tissue. You need to increase the length through stretching. You need to work on your strength. You need to own that mobility. That's why it's important that you not only do some research yourself, but possibly reach out to someone that is a professional that you trust, whether that's us or someone that you already know around you. There are a lot of other techniques that I'm not going over, and generally, exercise and mobility work, moving through full ranges of motion, challenging that stiffness, is an excellent way to break up adhesions and to change scar tissue. However, sometimes you need some outside help. Post knee replacement surgery, there are too many adhesions around the knee itself, and it just simply can't do it by yourself. It is too painful, and someone else needs to help you. But movement is key. Exercise is great. It doesn't need to be complicated. It just needs to make a difference. If you have any questions, feel free, please, to put those questions below and we will answer any of them. If you have a differing opinion, feel free to share that too. Please subscribe to our channel. We have gone over already how we like to perform instrument-assisted soft tissue mobilization, and we've provided all these other techniques about breaking up adhesions and scar tissue already. We're going to continue to provide you with all of the ways to help yourself. Thank you for watching. Talk to you soon.